You guys have been asking for a deep dive on new treatments for HHT, and well, this research is really promising.
It is. Yeah,
Yeah,
it could really be life-changing for some people.
absolutely. So, for anyone who might not know much about HHT, what is it exactly?
Well, HHT stands for Hereditary Hemorrhagic Telangiectasia. And
Hmm.
basically, it's a genetic condition
Okay.
that affects how blood vessels form.
Hmm.
So instead of developing normally like they should, the blood vessels can be kind of weak and dilated.
Oh, wow.
And in some cases, there could even be like these abnormal connections between arteries and veins.
And those abnormalities can cause all sorts of problems throughout the body, right? But it seems like nosebleeds are a particularly difficult symptom to deal with.
Yeah, you're right. Nosebleeds are very common and they can be really severe and happen really often too. We're not talking about just your everyday nosebleed here.
Yeah.
Imagine like waking up multiple times in the night because you've got a nosebleed,
Oh, God.
or having to like step out of a meeting because you feel one coming on.
That would be awful.
Yeah, so it can be really debilitating physically and emotionally.
Yeah, I can imagine.
And then on top of all that, sometimes these frequent nosebleeds can lead to other problems, like iron deficiency anemia.
So is that where this new treatment comes in? Is it specifically for treating these HHT-related nosebleeds?
Yeah, that's right. The research we're looking at today is focused on a drug called pomalidomide.
Pomalidomide.
Yeah, and you might be interested to know it's already actually used to treat certain types of cancer.
Oh, wow.
Yeah.
So how does it work? What makes pomalidomide a possible treatment for HHT?
Well, basically, pomalidomide works by inhibiting the formation of new blood vessels.
Hmm.
And researchers think that by doing that, it could potentially stabilize those abnormal blood vessels we talked about in HHT.
Okay.
And that hopefully would mean fewer and less severe nosebleeds.
It's so interesting how a drug that was created for one condition can be promising for something completely different. Like, how did they even figure that out?
Well, they didn't just start giving it to people with HHT to see what would happen.
Of course, yeah.
They did a clinical trial to figure out if it was actually safe and effective.
Makes sense.
This particular trial was called PATH-HT, and it involved 144 adults with
Okay.
HHT who all had a history of pretty bad nosebleeds.
Yeah, so these weren't just people who got a nosebleed every now and then.
Exactly. These were people who were really struggling with this, like their quality of life was being seriously affected.
Yeah.
So, to study the effects of the drug, they split the participants up into two groups.
Right. One group got the treatment and the other got a placebo, right?
Yep. And in this case, the treatment was 4 milligrams of pomalidomide every day for 24 weeks.
Okay. And the other group just got a placebo pill for that same amount of time.
That's right. And throughout the study, the researchers kept track of everyone's nosebleeds.
How did they keep track of that?
They used something called the Epistaxis Severity Score, ESS.
The ESS.
Yeah, it basically just lets them measure how bad the nosebleeds are in a really objective way.
Okay, so they had a scoring system. That's cool.
Yeah, and they didn't just look at the ESS score, they also tracked other things too,
Like what?
like how many blood transfusions each person needed
Oh, right.
and how much iron they needed through infusions.
To counteract the effects of the nosebleeds.
Exactly. And they also looked at levels of different things in their blood that can show iron deficiency anemia, like hemoglobin and stuff like that.
So they were looking at the bigger picture.
Yeah, they really wanted to see if pomalidomide had an impact beyond just reducing the nosebleeds themselves.
Right. Did it help with the anemia too? Or was it more like just a Band-Aid solution?
Good question. And that's what we're going to talk about next.
So did it work? Did they see improvement with the pomalidomide?
Yeah, they did. They actually saw some pretty significant improvement.
Really?
Yeah, so compared to the placebo group, the people taking pomalidomide had a much bigger reduction in their nosebleeds.
Wow. That's amazing. I bet that made a huge difference for those people.
Oh, yeah, totally. Imagine, like, finally being able to get a good night's sleep, you know,
Right.
or not having to worry about, like, getting a nosebleed when you're out to dinner or something.
It's crazy how something that might seem kind of minor could have such a big impact on your life.
Yeah, for sure. And remember how we talked about those other things they were tracking? Like the blood transfusions and iron levels?
Yeah.
The pomalidomide group needed way fewer blood transfusions and iron infusions compared to the placebo group.
Really?
Yeah, and their hemoglobin and all that stuff also got better.
So it seems like maybe it wasn't just masking the problem, but actually like helping those blood vessels get stronger.
Right, exactly. And something else that's really interesting is that these positive results, they were seen no matter what gene mutation was causing the person's HHT.
So it could help lots of people with HHT, not just a small group.
Exactly. That's what makes it so promising. But of course, no drug is without its downsides.
Right. Were there side effects?
Yeah, there were some. The most common ones were a low white blood cell count, which is also
Mm.
called neutropenia,
Okay.
and then constipation and rash were also reported.
Mm. Were those side effects usually pretty bad or manageable?
For the most part, they were mild to moderate,
Okay.
and they could often be managed by just tweaking the dose a bit
Hmm.
or with other treatments.
Okay, that makes sense.
And I think it's always important to remember that with any drug, you have to weigh the potential benefits against the risks. And in this case, the benefits seem pretty significant.
Yeah, for sure. So it sounds like there's a lot of potential here, but it's still early days, right? Like, I'm sure there's still more research that needs to be done
Oh, absolutely. This is really just the first step. One question that comes up a lot is whether a lower dose of pomalidomide could be just as effective.
because they were using a pretty high dose in the trial, right?
Yeah, they're using 4 milligrams a day, so it'd be interesting to see if you could get the same benefits with a lower dose and maybe fewer side effects.
Makes sense. So what else do researchers want to know about pomalidomide and HHT?
Well, one thing they're really interested in is whether pomalidomide could also help with other HHT-related problems, not just nosebleeds.
Right, because HHT can affect other parts of the body too.
Exactly, like the lungs, the GI tract.
And those can cause serious problems too.
Exactly. So they're looking into whether pomalidomide could help prevent or reduce internal bleeding in those organs as well.
That would be huge.
Yeah, it would be a game changer. And there's another area of research that I think is really interesting.
What's that?
It's all about understanding exactly how pomalidomide works on like a cellular level.
So not just knowing that it works, but why?
Right. If we can figure that out, it could open up a lot of possibilities for developing even better treatments for HHT in the future.
Yeah, that makes sense. Like treatments that actually address the root cause of the problem, not just the symptom.
Exactly. That's the dream. So yeah, there's a lot to be hopeful about.
Definitely. So where do we go from here? What are the next steps for research and treatment? This is really exciting stuff. We've come a long way from talking about how challenging HHT can be to like this whole new potential treatment.
Yeah, definitely. It's a big deal. And, it wasn't that long ago that there weren't nearly as many options for treating HHT.
That's true. So where do we go from here? Are doctors going to start prescribing pomalidomide for HHT like tomorrow?
Probably not quite yet. I mean, the results of this trial are super promising, but it is just one study.
Right.
So there's always going to be more research that needs to be done,
Yeah.
to be sure.
Yeah, like to figure out the best dose and if it can help with other HHT problems, not just nosebleeds.
Exactly. But even though it's still early, I do think this research has the potential to really change things for people with HHT.
Yeah, it seems like it could open up a lot of new possibilities.
For sure. And it's not even just about this one drug. This research could lead to even more targeted and effective treatments down the road.
That's amazing. Treatments that could really change people's lives.
Exactly.
Yeah,
And it just goes to show how important it is to support this kind of research.
absolutely. Who knows what other breakthroughs are out there just waiting to be discovered.
Exactly. This is really promising stuff. I'm glad we got to dive into it.
Me too. Thanks for walking me through all this research.
Of course. Anytime.
Hmm.
And for everyone listening, if you want to check out the studies we talked about today, you can find links to them in the show notes.
And be sure to join us again next time when we take a deep dive into another fascinating topic.